Creutzfeldt-Jakob disease, CJD, is a rare fatal brain disorder. The incidence is 1 in a million. There are 3 types of CJD: sporadic CJD, familial CJD, and acquired CJD. Sporadic CJD develops spontaneously for no known reason. Familial CJD is a hereditary form caused by certain changes in the prion protein gene. There are 2 types of acquired CJD: iatrogenic and variant. Iatrogenic CJD is caused by contaminated surgical instruments, corneal transplants, or human growth hormone. Variant CJD is caused by contaminated beef or blood transfusion. This type is the one we are going to focus on. Now for some Steffi stats. The consumption of cow contaminated with the agent of bovine spongiform encephalopathy, BSE, aka cow disease, has been strongly linked to the occurrence of vCJD in humans. 175 cases of vCJD were reported in the UK and Northern Ireland, and 49 cases in other countries from 1996 to 2011. Since 2000, mad cow disease has declined significantly in the UK.
CJD is one cause of dementia and results in the destruction of brain cells. This occurs when the prion protein folds into an abnormal shape and over time begins to accumulate. These accumulations become plaque that interferes with the synapse function. The nerve cells are eventually damaged and lost, which then causes tiny vacuoles to form in the brain. These give the brain a spongy-like appearance, hence the term spongiform disease. Some of the symptoms may include clumsiness, balance, and coordination dysfunction, changing gait and rigid posture, involuntary movements, as well as jerky movements. Other symptoms include memory loss, personality changes such as depression, and seizures.
The diagnosis of variant CJD consists of a variety of tests, which includes a complete medical history and physical examination, an MRI, which measures the amount of atrophy or shrinking of the brain, an EEG, which assesses the electrical activity of the brain. The EEG may illustrate sharp abnormal wave patterns and are present in 80% of individuals with variant CJD. A spinal tap can also be performed. The patient's cerebrospinal fluid is extracted and analyzed for specific proteins that are consistent with mad cow disease. A brain and/or tonsil biopsy can be performed to determine the cause of infection. Currently, there is no cure for variant CJD, and death occurs approximately 1 year after the onset of symptoms. However, the patient's symptoms can be managed with pain and antiviral medications.